Hey everyone, it's Sarah with RegisteredNurseRN.com, and today I'm going to talk to you about what to do if you fail the NCLEX exam. Did you know that according to the National Council of State Board of Nursing, that only 84.48% of students who took the NCLEX in 2015 for the first time actually passed? And of that, 86.77% were U.S. educated that passed the first try, and only 30.91% were internationally educated. So these statistics right here show you that people do fail. It's normal. This exam is hard. So what is the NCLEX? Well, the NCLEX is a big exam that nursing students must take in order to become licensed to work as a nurse. They went through nursing school, they did all that hard stuff, but now they have to pass this exam in order to work as a nurse. There's the nclex-rn, which is for registered nurses, and then there's the nclex-pn, which is for licensed practical nurses. So chances are, if you're watching this video, you're a person who just failed the NCLEX, or perhaps you're worried that you might fail it because you're fixing to take it, or you took it and you walked out of there thinking you failed. So in this video, I'm going to try to encourage you of the people who have failed, and I'm also going to give you some tips on what to do to help you pick yourself back up and get out there and start studying again so you can pass this exam. So first, there's some things that you need to understand if you fail the NCLEX, okay? First of all, failure does not mean that you are going to be an incompetent, terrible nurse and that you're not meant to be a nurse and that maybe you shouldn't have done this. It does not mean that. I know so many wonderful nurses who are working right now who failed this NCLEX the first time, even the second time, because this exam is hard. It's very, very hard. And some people just aren't good test takers. I know with the ACT and SAT, I had to take that thing like several times before I could actually get into a university I wanted, because I am not a good test taker. But you can learn to become a good test taker. Or maybe you didn't prepare as good as you should have the first time, because, you know, if you just graduate from nursing school, you're trying to juggle nursing school, you're trying to pass those exit exams, you're dealing with graduation parties, you're dealing with so much stuff going on, so you didn't really have a lot of time to prepare for the first time. But guess what? You got a second or third time and you can do this. So either way, it's okay you failed. It happens. Let me share a story with you with one of my friends. Whenever I graduated from nursing school, I was precepted by one of my, who became one of my good friends, and she is smart. I mean, she is just an excellent nurse. If I had a family member, best friend, anyone in the hospital, I would want her as my nurse. She worked as an ICU nurse, became a travel nurse. I mean, just very, very smart, and the doctors respected her, just knew that she knew her stuff. Well, one day she confided in me that she did not pass the NCLEX the first try, and I was absolutely shocked, because if anyone in the world was going to pass the NCLEX the first try and make straight A's in nursing school, it was this girl. But she didn't, and that right there still to my mind, NCLEX is not about if you're going to be a good nurse, if you're smart enough. It's just a test that we have to take because they need something to say, hey, you can do it, you can work as a nurse. But later on, she went on to go to Vanderbilt, which is a very prestigious school, and advanced and became a nurse practitioner. And she has a very successful nursing career. And she failed the NCLEX the first try. So it happens. And that story, I like to share that story with people because that will help give you inspiration, letting you know just because you have failed does not mean that your nursing career is not going to go anywhere and you're not going to do anything with it. It doesn't mean anything. It's just this test that you just happen not to do good on. So don't beat yourself up, and don't let negative thoughts dominate your mind, because if you do, you're going to really psych yourself out and stress yourself out for the next time. And you need to pass the NCLEX, and you will pass it. So what to do if you fail? Okay, like I said, it's normal to feel down. What you need to do is you need to vent, you need to cry, you need to take that week that you have found out that you failed, and you need to do some things for yourself. Take a mini vacation, watch movies, sit around, eat junk food, just really drown yourself in your sorrows, because it's part of coping and it's part of getting through this. But after that time you've gave yourself to get over it, you got to dust yourself off and you got to say, I've got to think of a new plan and I'm going to tackle this. It's happened to other people and I'm going to get through it. So one thing I suggest doing is look back at how you studied last time. Be truthful with yourself. How did you prepare? Okay, look at what study guides you use. Okay, what you need to do is get the latest study guide. I really recommend either going with Saunders or Kaplan. Those are the top brands on the internet, in the nursing world, among nursing students who have passed NCLEX. And don't go with like 5 different study books. Pick one and stick with it, because all these NCLEX books are essentially the same. And what you want to do is you want to, of course, practice questions, but you also want to look at your weaknesses. You need to see where you don't do good on. And how you do that is you get the CD that comes with the book and you take their comprehensive test. The Saunders book is great for this. They have a comprehensive exam that's like a mock NCLEX, and it will test you on all the areas that you will see on NCLEX. Then after the exam, it will give you a printed out summary of what you didn't do good in. So say you didn't do good in fundamentals, med-surg, pharmacology, and like you did bad in pharmacology on psychiatric drugs. So what you would need to do, you need to go into the NCLEX book. The book's like this thick because it has everything you need to know, and you need to review those psych drugs. You need to see what the side effects are. You need to see what they interact with. You need to look at nursing interventions. That's a lot of stuff that NCLEX wants to ask. What are you going to do as the nurse? So you need to look back at that, and then you need to go back and practice questions mainly in that area. On the CD, you can select certain areas you want to test yourself in. But key, don't try to memorize those answers, because those questions you're seeing on the CD aren't going to be the same exact questions on NCLEX. You need to go and you need to see why you got those questions wrong, and you need to read the rationale, and usually they give you a page number where that information is on the book, and you need to go back and you need to read it and you need to digest it and make it stick in your brain, not just memorizing facts, because you've already got through nursing school. You know nursing school is not just about memorizing facts. It's about knowing this material and being able to apply it. So do that. Practice questions, read your book. Practice questions, read your book. Next, block out time where you can study this material. Every day until you sign up to take that next NCLEX exam, you need to be dedicating, even if it's just 2 hours a day, every day you need to be reviewing this material, going over it, reviewing it, going over it. And if you're working, hopefully you're working in a hospital setting where you can have your friends who are on the job help you study by asking you questions as they go throughout their day. If you're working with a preceptor, they can help you with questions as well. But you need to make sure you're exposing yourself to this all the time. And also, just a side note, whenever you sign up to take the NCLEX again, make sure you don't sign up too early or too late. If you sign up too early, you may not be prepared to take the exam, but if you sign up way too late, you're going to forget a lot of this material, especially if you've came out of nursing school. A lot of this stuff's going to start to fade. So make sure you pick a good medium time to take it when you feel like you're ready. Okay, and also, last but not least, if you find that you don't keep motivated, you need something to keep you motivated, you may want to look into those reviews. There's a Kaplan review and a Hearst review, and sometimes those offer money-back guarantees if you don't pass after you do their program. You want to look into that. But they are expensive. They cost anywhere from $200 to $400. But if you didn't do that the first time, maybe you should try it the second time. A lot of people find them useful because they help keep you motivated. But just keep in mind, if you're going to those reviews, you need to make sure that you're studying yourself before you go to the reviews, because a lot of people make the mistake of just going to the reviews and not doing anything on their own. But that will help keep you motivated and help keep you ready for studying for NCLEX. So in conclusion, don't lose hope. If you have failed, you're watching this video because you have failed, don't give up. It does not mean that you're going to be a terrible nurse. It doesn't mean that you're not going to be a nurse. You will pass. This happens all the time. I have worked with people who have failed, but they dusted themselves off and they got back up there and they passed, and you will pass. So I hope this video helped you, and I hope you and I pray for you that you pass the NCLEX. Again, you can get through this, you can do this, and thank you so much for watching, and please check out my other videos about teaching tutorials, nursing school, how to get that job, and please don't forget to subscribe to my YouTube channel. Thank you so much.